confronted with chronic pain, one of the areas that we're looking at with the release of the guideline is to really understand how is the guideline being implemented in primary care settings. The guideline is intended primarily for looking at the treatment of chronic pain outside of active cancer treatment, as well as palliative and end-of-life care. And in our collaborations with state partners, so currently CDC works with 45 states in addition to Washington, D.C., to see what decisions are being made within individual jurisdictions around. So if you think about Medicaid, that's a particular lever for states to address how patients are who have chronic pain are being assured that care is being provided. So we're actively working with states, we're actively working with CMS. We're also very sensitive to the fact that it's certainly an unintended consequence if an individual would be dropped from care. The intention is that primary care providers would have looking at the science that's related to prescribing, would have a better understanding of what are the inherent risks associated with prescribing opioids long term. And with that goal in mind, trying to understand that if an individual is being initiated in terms of that first prescription related to an opioid prescription, what are those opportunities to look at pain and function and to assure that the individual is being prescribed at a very judicious morphine milligram equivalent so that the person is not placed at risk. And then thinking about those patients that are already on high dosages, are there ways that tapering could be incorporated into...
But why are we tapering if they're safe, if they're already in stable treatment? And you stated in this show that this was for primary care settings, not disease patients. It's being applied to people with complex diseases. They're dying at 40 a day.
So
And that's that's an epidemic.
So looking at individuals who are already on higher dosages than 90 milligrams.
That's not what I said, though.
So those individuals are at greater risk for overdose.
That's not what I
and death.
asked. I asked, what were you going to do to protect people who need it? I didn't ask about 90 milligrams. I didn't ask that.
We collaborate both with commercial and public payers, and they're making the decisions around access to care. CDC is not...
Well, everybody's saying that they're doing it because you guys said. Every stakeholder is stating the CDC is the reason they're doing all these things at the law, at CMS, at the pharmacies. So there are about 30% of our population is disabled, elderly, and impacted potentially by these decisions. We can see in the numbers that this is now a fentanyl crisis and a heroin crisis, which we have, and I greatly respect the work done to prevent that. So please don't take that the wrong way, but there's a huge population that we're not even inviting to the discussion. You're cutting and throwing people off their medication against their will, not you, but everybody is citing the CDC is the reason to do it and saying, too bad. When people are complaining, saying, I'm getting sicker, help me, and then they get thrown into psych units against their will. I started a nonprofit. This is from real people. This isn't a made-up thing. I get emails every day from people on the streets basically telling me they're gonna kill themselves because they can't get medicine from their doctor anymore. They go to the hospital, they get told they're a drug addict and laughed at when they're in an emergency, life-threatening situation. And everybody states, I'm sorry, but the CDC says. Not one study was done for over 12 weeks. So 12 weeks is your long-term chronic pain, and you don't have studies over 12 weeks. So I respectfully ask, let the people who are being affected into this conversation, and seriously into this conversation, not just, I know and I understand. No, you don't understand what it's like to wake up every day and not know if you're gonna live or die because someone else is gonna believe you or not.
I have a question. What does the CDC?
Nice answer.
What is your stance